Hi. Today let's talk about the cervical cancers and how to prevent the cervical cancers in women. Now, when you look at the cervical cancers are the fifth most common cancers worldwide in all human beings. And these are the second most common cancers that occur in women. Uh, Worldwide, there are about 551,000 cancers, cervical cancers, that occur every year, and the number of deaths are 288,000 deaths per year because of cervical cancers. Now, in India, it's a developing country, and cervical cancers are one of the most common causes of deaths in the Indian women. We have about 132,000 new cases annually of cervical cancer in India, and we have about 78,000 deaths occurring annually. Now, the cause of cervical cancer is very well known. It is caused by a virus, which is a DNA virus, which is called the human papilloma virus, or the HPV virus. There are about more than 100 type of human papilloma viruses, and out of them, it's only about 15 or 20 human papilloma viruses that can cause cervical cancer. And so the HPV viruses are divided into the low risk, the probable high risk, and the high risk groups. Now, the high risk HPV mainly are the HPV 16 and 18. These are the ones that are known to cause almost about 70% of the cervical cancers. The other low risk human papilloma viruses, if they are infected, if they infect somebody, they can cause genital warts, anal warts, or even oropharyngeal lesions. Now, coming to the do all people who have human HPV infection, do all of them develop cervical cancers? Now, it's in a lifetime, about 50 to 80% of all women have an HPV infection. Most of these infections are cleared, only 1% become chronic, and this 1% may lead to a cervical cancer. The 1% that leads to the cervical cancer. Now, what are the changes that occur in these? What happens in the cervix of these women? What normally happens is that there is a transformation of the normal cells to abnormal cells, and the women undergo changes in their cervical epithelium, and these changes can be from cervical intraepithelial neoplasia 1 to 3 and to invasive cancers. So there are these changes. The cells start getting abnormal around the transformation zone. The cells start getting abnormal. This human papilloma virus is the most important necessary factor for cervical cancer, but those 1% have other cofactors that can cause the cancer. And these cofactors are: smoking is a cofactor, multiple pregnancies is a cofactor, sexual initiation at an early age is a cofactor, pregnancy and delivery at an early age is a cofactor, multiple sexual partners is a cofactor, and people who are on women who are on contraceptives, or women who are low on, who are obese, or women who eat less fruits and vegetables, they are also prone to develop cervical cancers. Our point here is the prevention. How do we prevent these cancers? Is there any way that we can prevent these cancers? Now, once the HPV, human papilloma virus infection occurs, it takes about 10 to 15 years for the cervical cancer to develop. So if we can catch the human papilloma virus early, or the changes that are occurring in the cervical epithelium early, we can prevent this very, very disastrous cancer. Now, all that one needs to do is to do a pap stain, or the Papinicola stain. Pap stain is a simple smear which is taken from the mouth of the uterus or the cervix, and it is seen, and under microscope the smear is looked at, and one looks to look at some abnormal cells. This is recommended. The question is, when do you initiate? Is it a cancer of the old, or should you initiate this testing early? Now the recommendation is that the pap smear should be done early. It should be started at the age of 21 years, and it should be done every 3 years till the age of 65 years. Another recommendation, which is more scientific and more logical, is to do the co-testing. Now, co-testing is doing the pap smear and also looking for the human papilloma. So, the HPV testing, looking for the human papilloma virus in the cervical smears. This is a very, very significant test, and if this test is positive, then the patients are followed up regularly, and one specifically looks for the changes within the cervical cancer. I mean the cervical cells. Um, Another very important thing for prevention is to report the symptoms. If there are any abnormal symptoms like vaginal discharge or bloody discharge or um, blood stain discharge after sexual intercourse, or if there is pelvic pain, to report all this to the gynecologist. A gynecological examination is extremely important, and one should go and get oneself physically examined by the gynecologist quite regularly. Now, if the human papilloma virus is positive, then one should also do an E6, E7 mRNA testing, which tells us whether this virus is going to become is oncogenic, whether a cancer is going to develop within the cells or not. This is all about cervical cancers today, and my message here today is only prevention, prevention, prevention. It's a very simple test. Please do your pap stain starting from age 21 to age 65. Do it regularly, every 3 years. Please get yourself examined by the gynecologist. Please do your co-testing, which is HPV virus and the pap stain regularly. If you are a woman less than 21 years or a teenager, please get an HPV vaccination. That's all for today. We'll catch up with more prevention of more other cancers subsequently.